When should my FRAX score lead to osteoporosis treatment? Imagine having a simple tool that helps your doctor decide if you need treatment to prevent broken bones in the future. That tool is called the FRAX score. It estimates your chance of having a major osteoporotic fracture within the next 10 years, focusing on bones like your spine, hip, or forearm. It also calculates your specific risk of a hip fracture. This score is especially helpful when your bone density test, known as a DEXA scan, doesn't clearly show osteoporosis yet, but your overall risk might still be high. If you have already experienced a fragility fracture, which means breaking a bone from a minor fall or injury, treatment is usually recommended regardless of your FRAX score or bone density results. This is because a prior fracture indicates your bones are fragile and at higher risk for future fractures. For those who haven't had a fracture, your doctor will look at your FRAX score along with your bone density and other health factors. If your 10-year risk of a major osteoporotic fracture is 20% or higher, or if your risk of a hip fracture is 3% or higher, treatment is generally advised. These thresholds are based on guidelines from various health organizations and help identify those who would benefit most from preventive therapy. Even if your bone density shows osteopenia, which is lower than normal but not yet osteoporosis, a high FRAX score can still suggest that treatment might be helpful, especially if you have other risk factors like smoking, alcohol use, or a family history of fractures. Sometimes, your doctor might recommend a DEXA scan if your FRAX score falls into an intermediate range to gather more detailed information about your bone health before making a decision. In some countries, like the United Kingdom, guidelines suggest using the FRAX score to guide treatment decisions even without a bone density test, especially for women after menopause who have had a previous fracture. It's important to remember that FRAX does not account for all risk factors, such as your fall risk or certain health conditions. Your healthcare provider will consider your overall health, lifestyle, and other factors that might influence your fracture risk. Ultimately, treatment decisions are personalized. Even if your FRAX score is below the usual treatment threshold, your doctor might recommend therapy if you have other strong risk factors or very low bone density. The goal is to prevent fractures before they happen by carefully evaluating your individual risk. Always discuss your specific situation with your healthcare provider, who can help interpret your FRAX score in the context of your overall health and guide you toward the best plan for maintaining strong bones.